Well, good morning. My name is Dr. Arbor. I'm here at Arbor Family Chiropractic with two longtime patients who have been a part of our practice for quite some time. This is Judith
Hi.
and George. Good morning.
Good morning.
And they're here to share a few thoughts and reflections on the time they've spent here in the office. I think, let's see, goodness, I'm looking at your charts here. George, you've been here since 2006,
Yep.
right? So that's now 13 years. And Judith is 2010, so that's 9 years.
9 years.
So yeah, quite some time. Do you guys want to start with maybe just what brought you in originally and what was that like? And
Well,
George would be the first.
very good. I've been a long time user of chiropractic service. I had a car accident 40 years ago now, and had a long time chiropractor in Ann Arbor, but I hit the wall. We weren't making any progress. It was the same symptoms, the same treatment, and the same. But we weren't. It's a little bit crazy. We weren't getting any results.
this was a previous chiropractor.
Previous
chiropractor.
Got it.
And that technique was, I would say, very aggressive. And I was got a recommendation from a neighbor to give you a try, and I was a little bit put off because I would say you had a very gentle approach. And I'm going, how are we going to get any results with this? And you concentrate very much on the neck, and it was only, I don't know, seemed several years later that we did any lower back work at all. And of course, it's a slow process, but I feel now that I'm definitely in a maintenance place where I may have a glitch now and again, but just being able, just knowing, I think my body knowing that I'm coming back and that I'm gonna get straightened out again, that I feel it's been a very successful relationship, very successful treatment, and I didn't have any issues with the personality of my previous chiropractor, and that's held up true. A terrific person, terrific personality, and just enjoy every visit.
Wow.
He did try to hedge his bets in the beginning a little bit, and I rescued all of us because he had a relationship with the other chiropractor, and he was playing both ends. He'd come and see you, and then he'd go and see. And it took me a couple of months to say, "Do you realize you're undoing? You needed to make a change." And Dr. Rob has a special way of handling it that's different than the other doctor. And you're undoing. You need to give Dr. Rob a chance. And then he went, okay. And once that happened, he started having improvement.
Oh, nice.
So I saved us.
Oh,
But he started to have improvement, and he was doing better. He slept better, didn't have to sit up in the night to try to take the relief off. Every now and then, we go into old habits and need to do those things, but then we come back into you, and that's taken care of. For me, I had just had years and years and years of terrible problem of strain in the neck that would be in the shoulder. And we came into our relationship, second relationship, and it was new, and we're the age we are, and every single day I have this terrible pain and burning, and I'm asking him, please rub, please massage, please, and every single day. And so after 4 years of that, from 2006 to 2010, he said, that's it. He's not doing that anymore, that I have to come in and see you.
Right,
and
right.
I was afraid. I was afraid. Oh, no, I don't want anybody to mess with things. No, that's not right. But it was gentle. And I started out with Dr. Sherry, who was wonderful. She's great. I can go back and forth between the two of you without any problem. Schedule-wise, you worked out better for the two of us, and so you've been who I've stuck with, and that's worked out really well. The pain is gone. If it's a rub, it's just a nice rub, not because I am in any kind of difficulty. I like the maintenance. You've been really gracious to say I don't need to come in as often because I do hold a long time, but I like to come in here. I want to come in here. This is a great place. It's a really wonderful people. The patients are wonderful. This is a calm and peaceful, soothing, comforting environment. I go out feeling like I've been paid attention to and that I'm in touch with myself. Probably the biggest surprise, the best benefit, because we were talking about pain in the neck and the shoulders, but I've had orthodontia problems for a long time. I had orthodontia from the time I was a child into my adulthood, decade of braces on and off, and again, and I have a lateral slide that makes things really uncomfortable and tight. I grind my teeth and things like that. And the adjustments, when I need one, I can tell because my teeth aren't aligned. When you make an adjustment, then my jaw and my teeth align better, and I have a better result with chewing, better result in my jaw. So it's a total different place of my body than we're thinking about, but it totally, I walk out and my teeth are back.
Yeah,
Back straight. They seat properly in the back.
Yeah, perfect, wonderful. Well, yeah, one of those unexpected side effects of chiropractic care.
Works for me.
Unexpected
So
benefits.
he doesn't have to rub me as much, and I chew better.
Yeah, so I solve not only your problem, but also his problem. Yeah. Sounds good, very good. Very good.
Audrey is
So
terrific.
gracious, so wonderful, and we loved coming in and talking with her, and her greeting us and responding to our sudden changes of schedule and all those kind of things. So.
Yeah, being a yeah.
No, it is.
Yeah.
You're a community booster, and it's reflective. The community gives it back to you, and I think it walks through the door every day.
Yeah.
You're good for them. They're good for you.
Well, that's a nice relationship. Yes, and we enjoyed that relationship and being part of it and being active. So great. Well, thank you for spending this brief moment to help us capture these